Hi everyone, welcome back to Glow Up and Wellness. All we do on this channel is we talk about health awareness. We bring information to you, we do our research because we know you are too busy, but we do the research for you and we bring our findings down to you here. If you are new here, don't forget to hit that subscribe button and click on the icon bell to stay updated with all our latest content. Today, we're going to be delving into an important topic. And what's this topic? High blood pressure, also known as hypertension. And as you can see on this screen, it's saying cardiovascular disease because that's the class it belongs to. So we are going to be looking at 7 key questions that you should ask your doctor once you have been diagnosed with high blood pressure. Understanding these questions, getting answers to these questions will help you in a very big way that you will appreciate watching this video today. And please, after watching, do not forget to subscribe if you've not subscribed, and share because people need to hear this. Share. And you can write down these questions as you're watching. Go get a pen and paper and write down the questions that will be coming up on the screen. So when you go to your doctor, you will have your question at hand to ask him or her. So before we start, I just want to emphasize or repeat something so that everyone gets to know that high blood pressure is a very common condition, and it can affect both men and women, both the rich and the poor. Because while I was growing up, there's this notion that high blood pressure or hypertension is only for the rich and not for the poor, because probably they've borrowed money somewhere in the bank, so their heart starts racing or beating. How am I going to pay? But that's not the case. High blood pressure can happen to anybody, whether you are rich or you are poor, whether you are a man or you are a woman. And it is a condition that is a medical condition that if you don't take it seriously, because high blood pressure itself is a serious health problem, and if you don't take it seriously and you don't manage it properly, oh my God, the end result is not what anyone will want to tolerate. So please, as you watching this video, make sure you get your pen and paper and write this question 1 that is on the screen now. So the first question you have to ask your doctor is, what is my blood pressure reading, and what does it mean? He will tell you. He's going to provide you with 2 numbers, which is showing on the screen now. So these 2 numbers, you have the upper number, as you can see, is what we call the systolic. And what is the systolic? That is the force of contraction. And then while the lower number is the diastolic, that is when it is now relaxing, it's not contracting anymore. So these 2 numbers, understanding it will help you know the severity. For some people, high blood pressure, when they have it, it could be that it's the systolic. For some people, it could be having problem with the diastolic. So that is why it is very good you understand it, and then you know how to manage it. And if you are in London, in September there is something coming up, so make sure if you've not subscribe. And if you are not in London and you have a family in London, share this video with them, let them contact us, because there is something we are going to roll out in September. And what is that? It is a detailed cardio check. It's free. Once you're 40 years and above, it's free for you. And even if you've not been diagnosed with high blood pressure, you can come to us. Just DM me and said, book me. I will book you in, and then we'll take it from there. So it's free of charge. You don't have to pay anything. I'm not selling anything here. So I just want you to know that high blood pressure is not a condition you can joke with. Question 2. What are the potential causes of my high blood pressure? This is very important, because you knowing the causes of your high blood pressure will help you to learn also how to prevent it. Because for some people, or it could be genetic, because blood pressure can be caused by various factors like genetic, diet, stress, or other underlying health condition. So you identifying these causes can help you tailor or plan your treatment. And just a quick one, like I said, it could be genetic, diet, or stress. I want to quickly touch on that stress a bit. Don't be surprised, we are not how do I say this? Anyway, we are. Let me not say we are. No, we are, because I'm a CBT therapist. I'm trained as a marriage counselor. So, though that is not what I do on this channel, what I do on this channel mainly is all about health condition. But sometimes, don't be surprised when you see some of my videos talking about marriages. Why? Because, or talking about divorces. Why? Because people going through divorce, people going through tough time in their marriage, they go through stress a lot, and unknowingly to them, going through this stress could lead to high blood pressure. So sometimes you see me talking about divorces, or you see me talking about marriage. Don't be surprised. It's because I am holistic when it comes to managing health condition. I look at your environment. I look at your living, the way you live at home, everything. I take everything into consideration when I'm actually managing a patient. So I don't just say, oh, you go, is blood pressure. No, I am holistic when managing a condition. So don't be surprised if you see me talking about marriages. Question 3. What lifestyle changes can I make to lower my blood pressure? So your doctor, if you ask your doctor this question, if you are a man and you smoke, he might ask you to stop smoking. Not he might, he should tell you to stop smoking, because the nicotine that you inhale has a detrimental effect. So that's something for another day. We're going to be doing smoking cessation. I'm going to do a video on smoking cessation. And then if you drink alcohol, so normally we don't tell people stop taking or stop drinking alcohol. There is a limit. There is an amount you are supposed to take in a week. So if you want to know more, you can direct message me. I will tell you about that. In most cases, we tell people to reduce salt intake, because when the amount of sodium is, when I say sodium, I mean salt. So when the amount of salt in your body is very high, it has a detrimental effect. Another lifestyle changes your doctor will advise you to also incorporate under lifestyle changes is that you have to increase your physical activity. You have to do exercise. Be active. Do not live a sedentary lifestyle. Like, okay, maybe there's a remote on the table, you call a baby to come and give it to you, or you call your son, come get it. No, you have to be very, very active. So these changes, note them down. Stop smoking. If you smoke, stop smoking. If you drink alcohol, reduce the alcohol intake. It's 14 units per week if you are in the UK, both men and women. And then reduce salt intake and increase your physical activity. So these are what we mostly advise patients to do. But your doctor is not a one size fits all. Your doctor will tell you which one he wants you to incorporate into your lifestyle changes. Question 4. What medications will I need to take, and what are their side effects? This is very, very important. Understanding your medication and knowing how to take it and understanding the side effect, that will help you a lot. So now, your doctor, depending on your ethnicity anyway, your doctor can start you with what we call ACE inhibitor, which is things like Ramipril, lisinopril. Or your doctor can start you with what we call calcium channel blocker, which is an example is amlodipine. And then he can either start you, maybe if you cannot tolerate either ACE inhibitor or calcium channel blocker, the doctor might prescribe you what we call ARB, which is something like losartan. Or alternatively, they can give you what we call diuretics. Example of diuretics is in dopamine. But you see, these medications that I've just mentioned now all depend on your personal factor. So it's not a one size fit all. That is why it is not good you give your medication to somebody else. I'll give you an example. Some people can start with ACE inhibitor, Ramipre, and one of the common side effects is dry cough. So you see people, they are on Ramipre, they just start, they know it's a new medication to them, and then you see them coughing and coughing and coughing, and the cough is dry. It's one of the major common side effects. That's for Ramipre. It's not that it is not good, but it's just that you can't tolerate it. For some people, the coughing might stop after some time, but for some people, they can't just take it, because when they start coughing, some people start dripping down below. So we have to change that. Alternatively, if you are from African origin, your first line is usually calcium channel blocker. So it depends again on personal factor. It's not that, oh, because I've said it now, then you say, oh, I'm an African, I should be on calcium channel blocker. No. Your doctor will determine. Every treatment is personalized. So you can't just say because A is a Nigerian or B is a Ghanaian, they are both Africans, they both have to no. Always consult with your doctor to make sure he or she decide which one is best for you. And that is why you should never give your medication to anybody. Now, coming to calcium channel blocker, I just want to quickly touch on one side effect of it that is very common: swollen ankle. For some people, they are on calcium channel blocker, they don't have any swollen ankle. But for some people, they will just take it in less than a week, they already have swollen ankle. And what do? We have to change it. So what I'm advising you, talk with your doctor. Whenever you are on a new medication, talk with your doctor. And if you are in the UK, there is a service that is present to everyone. It's called NMS, New Medicine Services. Once you start taking a medication and you are new to that medication, however you react to it, is it working well, anything, go to your pharmacist. It is their duty. Go talk to your pharmacist, your local pharmacy. Go there and tell in fact, they will know, because the moment they are giving you the medication, your computer will show them that, oh, this medication is new to this person, and then they will definitely approach you and say, oh, we know this medication is new to you, we want to book you in for NMS, for New Medicine Services. So next time if they tell you they want to book you in for New Medicine Services, please do not reject it, do not turn them down. Make sure you agree to it, because when you start a medication, within a week you should start feeling something. So if it is the one that is not going to be compatible, then they can quickly change it. So that I always preach, make your pharmacist your friend, because it is they spent about 5 to 6 years learning medications, nothing else. So they know what they are doing. And then there is what we call AROB. AROB is an example of AROB is losartan. So losartan, if you can't tolerate this or this, we give losartan. And there are some people which there is a sign of fluid overload. There's too much water in their body and they are having this thing. What do we want to do? Our goal is we want to make sure they pee the whatever is in their body, the water, they pee it out. So we give them what is called diuretics. And with diuretics, we tell them, always take it in the morning. You can't take it in the night, because if you do it in the night at bedtime, you will not sleep throughout the night, because you will be going to the toilet, you'll be urinating. So that is for that. And then again, all this medication is start small and go gradually up. Your pharmacist, your doctor, they are your best friend. I'm not here to teach you, to educate you on that. But please do get in touch with them. They know what to do. So that's for the medication, and that should be your question 4. Please write it down and make sure you ask your doctor. And another thing, when you know your medication, you know what they will do, then you will know how to stick with it. You know how to stick with it. And then there was a video circulating around sometime not too long ago. They were talking about amlodipine. I tell you something, amlodipine, there is 2.5, there is 5 milligram, and there is 10 milligram. but you always start small. You always start with the lowest dose. And then there is one common grapefruit. You don't take it while you are on calcium channel blocker. You have to have, in fact, when we are talking about indication, contraindications, that will be on a different video. This one is just concentrating on questions you have to ask your doctor. So now let's go to question 5. Question 5. How often should I monitor my blood pressure at home, and what should I do if it is too high or too low? This is a very good question. If you monitor your blood pressure always at home, this will help you track your progress of treatment, if it's going good or if it is not. Your doctor will guide you on how frequently to check and what actions to take based on your findings, on your readings that you have. As you can see, the upper image on this, the upper picture, the one that has a red color, you see that the systolic is 236 and the diastolic is 116 millimeter mercury. This is very high. This person should be at the hospital. You understand? So, but your doctor will tell you what your range should be. And then the down one is 120/80, which is usually the normal one. And there is something I want to also quickly point out here. Depending on your person, everyone is not the same. For someone who is about 80 years, there is a blood pressure range that is expected of that person compared to someone who is about 40 years or 50 years. So there is a difference. So that is why you must not individual. You must not see it as a one size fit all. Is diabetic. If you are diabetic, your blood pressure reading is also different. So there is a range for each and every individual depending on your condition. If you are someone who has an underlying condition, so there are some readings we are receive from you and we say, oh, that is normal. So do not just take your blood pressure reading and then you start to panic. Speak to your doctor, speak to your pharmacist, ask them, what are my ranges? What should it be? How frequently should I monitor? This is a very important question, because if you know, if it's going out of range, you know when to take action. If it's too low, if it's too high, going out of range, you know what to do. And then if it's too low, you know what to do, because hypotension, not hyper now, hypotension is another trouble of its own. Hypertension is another trouble of its own. Our goal is to make sure that you are within the normal range. So please, your doctor, your pharmacist, they are your best friend. Please, especially if you've made, you made it in life, you have your wealth, you have your beautiful children, your handsome husband, your beautiful wife, you don't want to just die and let them go. No, you don't want to just depart. Don't delete yourself. Take action, please, and help yourself. So please make sure you monitor your blood pressure. Question 6. What are the potential long-term complications of uncontrolled high blood pressure? Please do not joke with your life. If you don't control your blood pressure, if you don't regard it, if you put it aside with a wave of hand, you could be inviting heart attack, stroke, aneurysm, heart failure, kidney problems, eye problems, metabolic syndromes. So what could happen if you don't control your blood pressure are those ones written on the red. This is just a few. It could lead to so many other things. And one thing, life without sickness is difficult on its own. Compare it to someone adding sickness, unknowingly or out of ignorance. When they say ignorance is no excuse fine. It's not only in the court of law, inside your body, whether you take medication or not, whether you say, oh, nothing is there, whether you say, I reject it or not, your hormones don't understand it. Your veins, your arteries in your body, they don't understand all these things you're saying. So the best thing, please, make sure you make sure your blood pressure is controlled, and do not joke with it. Some people will come to me and say, oh, I was on blood pressure medication before, the doctor said I should start. I say, doctor said you should stop? Oh my God, it doesn't add up to me, because no doctor or no healthcare professional will tell you to say, okay, stop your blood pressure medication when you have actually been diagnosed. If you've not been diagnosed, all right, but to say you are diagnosed and they said you have high blood pressure and the doctor will tell you to stop, no. If you are even experiencing high, like if it's reducing your blood pressure is going down too much, the highest they will do is they reduce your dose, and then they will do that. But to say the doctor ask you to stop the medication, please check yourself and check with your doctor again. So that's what I will say about that. So let's move on now to question 7. Question 7, this is the last question. If you've not been writing down, please do write questions to ask your doctor. So question 7 is, are there any other health conditions or factors that could be affecting my blood pressure? Yes, this is a very good one. When you ask your doctor this, he will tell you. When you have been diagnosed with high blood pressure, you make sure you monitor your blood sugar, even if you don't have it. So stop eating anyhow, so that you don't trigger diabetes. Because when you have high blood pressure and there is diabetes, I'm not going to tell you what's going to be there. So you need to figure that out with your doctor. And then again, another health condition that could result from high blood pressure, or that could impact your blood pressure, is what we call sleep apnea, or OSA, obstructive sleep apnea. So this is where when some people are sleeping, their lungs will collapse. They don't know, but because they are asleep. So it's a different topic entirely. So if you want to understand it, just message me and said, oh, could you please talk, can you please do a video on sleep apnea? Then I will do that. So if you see, so many things could lead to sleep apnea, and high blood pressure is part of it. You have cardiac problem, all these. Insulin, if you see, it said increase insulin resistance. So diabetes is not something you have to invite with your lifestyle, or with your hands, or with the way you want to live your life. But anyway, for diabetes, that one is a different topic. That one is coming on its way with another. That's 7 questions you also have to ask your doctor when you've been diagnosed with diabetes. So today one is just only on high blood pressure. So asking all these questions will help you and your doctor to create a comprehensive plan on the best way to manage your blood pressure effectively. Remember, your health is in partnership between you and your healthcare provider. I tell people, make your doctor your friend, make your pharmacist your friend, especially your pharmacist. When they give you medications, it's not enough when they just give you prescription, you go to the pharmacy, oh, can I get my medication? No, please, can you explain these medications to me? Ask your questions. What's this medication going to do to my body? What's my body going to do to this medication? Ask questions. What are the possible or likely side effects? What are the common side effects that will result out of me taking this medication? Please ask this question. So this brings us to the end of today's topic. And if you find this video very helpful, please do not hesitate. Give it a thumbs up. Share it with anyone who might benefit from this information. And don't forget, if you've not subscribed, don't forget to subscribe for more health tips and advice. And I want to say a big thank you for watching, and take care of your health. I'll see you in my next video. Bye.